disease. So today students will learn just an overview of what Baastrup's disease is, and we'll learn about some functional limitations that could occur with the disease, as well as some interventions that can go along with the different impairments. So again, for Baastrup's disease, it is also known as kissing spine syndrome as stated within Dutton, and it is also defined as an abutment within the posterior aspects of the spinous processes, which when that occurs is going to be due to like a herniated disc or an adjacent spinous process that's going to leave, that's going to protrude but still leave space within behind the spinal cord. And this usually occurs due to issues with like spinal extension or due like to the shape or issues in posture with like lumbar lordosis or just degenerative changes due to age over time. And then one article that I found, when I think they said it's since Baastrup's can be kind of misdiagnosed a lot, that it's usually around the L4 to L5 area. And so for the three impairments that we were going to do, we were going to focus on decreased lumbar extension, decreased step length, and postural imbalances.
Alright, so for our first impairment, we have decreased lumbar extension. In the max position phase, we're going to do single knee chest holds. We can regress that to using the band, or we can regress it to just using the wedge if they can't use the band, or they can't pull their knee with their hands and we just put a wedge on their legs. We can progress both of those to using double knee to chest hold. We can do both at the same time. Alright, in the mod position phase is where we would introduce extension-based exercises, and we will start with pronal elbows. That's a low way to introduce lumbar extension for this patient. We can progress that to a press up, also on the elbows, and we can regress both of these to just lying in prone. Oftentimes getting on their elbows can be a lot for this patient, so we can just have them lay in prone regularly to introduce lumbar extension. In the limb protection phase, we can have them do a bird dog. A bird dog can also be a functional type exercise, so you have to reach for the bird dog. That bird dog targets their glutes, your spinal muscles, from lateral medial, your ilicostalis, your longissimus and spinalis muscles. And those muscles are needed for your lumbar stabilization. We can regress this exercise to just doing bird dog one extremity at a time. So right arm, right leg, left leg. We can progress it. I have Superman on here as a progression. However, we can progress a bird dog by doing opposite arm, opposite leg, and just kind of taking it in the middle and going back out. The reason I have Superman on here because you have to go into shoulder extension and hip extension at the same time. So it involves more of muscle recruitment, basically. It's a little harder. So in the max protection phase, I'll have my patient in supine. I would have them in hook line. So can you lay on your back? And can you have your knees bent? Alright, I would instruct my patient to grab front of their knee and pull their knee to the chest. And I'll have them hold this about 30 seconds before I have them do the other side. The reason we're doing flexion instead of extension, also my impairment is lumbar extension, is because flexion decompresses the lumbar spine, which alleviates some of that pain that my patient is experiencing prior to doing any extension-based exercises. So that'll be for my max protection phase. Moving on to my lumbar protection phase, I'll have my patient on their stomach. I'll instruct my patient to just get on their elbows, don't lift up, but just get on elbows. So this is a low way to introduce lumbar extension. We don't want them to even press up. Pressing up can reproduce their symptoms because it takes them into more of a lumbar extension. And this patient, the spinous processes of the lumbar spine are compressed, which is causing my patient's pain. So we don't want to put too much compression on my patient in the lumbar protection phase. We just want to reintroduce some of that lumbar extension. If that's too easy, or when my patient is ready to progress, I can have them stay on their elbows but push up off their elbows, going into a prone press up like that. Alright, so in my minimization phase, I would have my patient do a bird dog. I would ask my patient to, I can demonstrate, excuse me, sorry. I'm supposed to be demonstrating anyway. So, for a bird dog, we can do opposite arm, opposite leg to start. To progress that, we do opposite arm, opposite leg, to, and to regress, we just do one at a time.
So just do the regular dog.
Yes, we're gonna do opposite arm, opposite leg to start. And that's how we start this. Then we're gonna progress it to doing opposite arm, opposite leg, and tucking in the middle. And that really challenges my patient's balance. That's how that's a progression. So they have to come to the middle. And these are some pictures of my interventions. Alright, so for my second impairment, I have decreased step length. Oftentimes, these patients spend a lot less time in stance phase because of the pain is so bad for my patient, so they don't spend a lot of time in stance phase. So their step length is not, they don't have a big step length, excuse me. So my max potential phase, I would actually start them with a posterior pelvic tilt. The reason I'm doing a posterior pelvic tilt is because for this patient, it's often seen they have an anterior pelvic tilt, which can often contribute to the pain that they're having, which can compress the spinous process of the lumbar spine even more and reproduce their symptoms, reproduce their pain. So I would teach them posterior pelvic tilt to decrease that lumbar compression and correct their pelvic alignment, which would decrease that pain for them. In the mock position phase, where I would start to incorporate some gait training type things, I would have them start with a standing march. The reason I'm having them do just standing march is I want them to get back used to taking bigger steps. I want to really exaggerate their movements and have them do standing marches. And that's a reintroduction of functional weight bearing without excessive lumbar extension. I would have them still tighten the core and really go into those standing marches to challenge their posture and while stimulating walking. All right, in the mid-petition phase, I have a obstacle course here. I will show you in a second, but we will start with just some cone step overs, really exaggerating their movements to really get them back used to taking bigger steps and being confident and comfortable taking those bigger steps as well. So, in the mid-petition phase, max petition phase, I have my patient on their back with your knees bent as well. So what we're gonna do is we're gonna tuck in our belly button and squeeze our glutes at the same time. Actually, can I stick my hand under your low back? So I'm putting my hand under my patient's low back, and I'm going to instruct them to push their low back onto my hand while tightening their core and their glutes at the same time. And I should feel their low back come onto my hand. Then I'm gonna move my hand from under their low back, and I'm gonna tell them to do the same thing, but push their low back onto the table. And that's a posterior pelvic tilt, which is correcting their anterior pelvic tilt, which should decompress their spinous process of the lumbar spine, which should alleviate some of that pressure and pain that my patient is experiencing. To regress this exercise, I can do abdominal bracing. I can just have them draw the belly button in without pressing the low back into the table. And that's a way to introduce that pelvic tilt. My progression, I can have them start to do marches here before I have them do them standing. So I tell my patients to engage your core and bring this leg up. Good, and then the other side, we can do about 3 sets of 10 here. I want to introduce them taking steps on the table before I have them take bigger steps on the ground and see how they respond to that first. All right, great. In the mock protection phase, I have my patients stand up and I'll raise the table up for them. If we're in clinic, we have parallel bars where my patient can do this in, but since we're not, we use the plinth. I'll have my patient on style of the plinth. I have them pick one leg up, then pick the other up. Again, this is getting my patient confident and comfortable taking bigger steps because we want to improve their step length. Because my patient doesn't spend a lot of time in the stance phase because of the pain that my patient is experiencing. To progress this, I can have my patient doing it on the blue foam pad, which mimics unstable surfaces in the real world, uneven surfaces in the real world. First, I want to assess my patient's balance, making sure she can stand on that foam pad before we even incorporate marches. Now that I see my patient's good, I will tell them to do the same thing, just on the blue foam pad. All right. To regress both of these, I can have my patient seated. The reason that seated is a regression because it decreases the axial load based on the spine due to gravity. So I have them do the same thing here because we know when we're standing, the axial load due to gravity is more on the spine. Perfect. All right. So in the middle rotation phase is where we start doing our cone step overs. So I will actually have a video of my patients as well. I would demonstrate this exercise for you. I'm not doing that yet. So I want my patients to stand up and step over that cone to the second cone. I'm instructing them step to the second cone because I want them to take a bigger step and get comfortable and confident in taking a bigger step. So cone's in front of me, I'm stepping over this cone, I'm stepping to my second cone, stepping over that cone, and stepping to my third cone. So on and so forth. And I'm going to be walking with my patient. Got it? Step over to that cone. Step over that cone. No. So let's start. Be behind me. Then we do left foot over to that cone. Perfect. Do right foot over to the next cone. Perfect. Left foot over. Perfect. Right foot over. Perfect. And all we're doing there is getting my patient more, like I said, comfortable and confident in taking bigger steps and improving their function while doing so. Lastly, I can do an obstacle course for my patient, which is just by adding this blue foam pad to the end. So we're gonna come back to our chair. We're gonna do the exact same thing. We're gonna take steps over each cone. Then we're gonna step on this blue foam pad, which mimics uneven surfaces in the real world, step onto a curve or anything you may experience in your real life. We're gonna step off the blue foam pad, then step back over. Then come back and step back down. Okay? That's good. Step on the blue foam pad. Now step off this way. Turn around, step back into the blue foam pad. Step off. Great. Two cones, looks good. Turn around and sit down. All right. And these are pictures of my interventions.
Alright, so for our final impairment, we focused on postural imbalances because one of the issues can be linked to lumbar lordosis, especially if they get too much of that. So you want to try to keep that stabilized so that the whole spine can stay stabilized and have good mobility. So for the maximum protection phase, we focused on some yoga poses known as like prone cobras. Regression of this you can do still be prone, but it's more like you're still laying down but not raising up as much. It's also known as sphinx pose. If you think of laying like a cat or like a sphinx statue. not put as much load. And then to add a little bit more of a challenge, you can do some prone cobra, but adding the rotation to it to help with giving more mobility within the spine. These do help to reduce pain within the lumbar spine, and as well as stretch out muscles within like the lower back. So like your core being like the transverse abdominis, rectus abdominis, the obliques, and it also helps like to target the core and hamstrings as well, and it also helps with promoting spinal stability and mobility, as well as opening the chest as well, since you do need that for posturing too. The next one we did was a cat-cow pose, but more within when you're sitting in a chair, you can regress that, which is seated, being on like a floor or like mat, and then progress that to quadruped. From what I read, I think in Keisner and Colby, I think like yesterday, so the quadruped has a higher center of gravity, so that can be a bit more challenging to help with trying to with stability and trying to keep posture. And again, these help with furthering to stretch out muscles within like the chest, abdomen, back, and upper neck, as well as to help with continuing the posture. So that is going to like target again like your, at least within this one, it'll help with like targeting more like your pecs and like your rectus spinae, and other ones like in the core, again, is like the transverse abdominis, rectus abdominis, obliques. And then for the final protection phase, minimum, we focused on planks or prone planks. These are also within like Dutton and in Keisner and Colby. So one article that I found, it did say that it talked about like different positions for like what muscles would be targeted within the prone planks. One of them, that from what I found, like for example, it said that like the internal oblique was like contracted more when you did like a prone bridge plank, or like a prone on like the ball with like hip flexion, for example. And it talked about like some other exercises that had more activity with some of the other different muscles as well. And the plank helps, of course, to engage all those core muscles within the core and lower back, just to continue to further challenge the stability and improve posture within the lumbar spine. So I'm going to show the pictures on the next slide for mine. So I'm going to demonstrate these first to my patient. So again, for the minimum protection phase, not minimum, maximum, excuse me, we would do the prone cobra. So I'd have my patient get in the prone. They'd then come up on their elbows and arms, and then push back into a cobra pose to help with initiating that stretch within the lower back and core, as well as opening the chest to progress that. So I could have them hold this for about maybe 30 seconds or so, and then do about 3 sets of that for 30 seconds. And then to progress that, I'll have you do this first, and then I can show you the progression. And then you come up when you're ready and hold that. Progression, if when they're ready to move on, they can do this pose and do it with rotation, like turning the head, come up, and then turn the back and head when doing so. And then regression, they could be prone and then just lay on their hands like a sphinx. And then so for my moderate protection phase, I'll have them do a seated cat-cow pose. Again, this is to still further engage the posture and stability within the spine. So have them come here. Well, I'll demonstrate first and then show him. So you arch your back into the cat, hold that for a few seconds, breathe, come back out and come into cow, and hold that for several seconds. And then hold that for about maybe 15 to 20 seconds. And then of course when you're ready, go back into the cow pose. And of course progression can be the quadruped and going into cat and cow. And then again, regression would be like to do it on just like seating on like a mat or on the floor. For our next exercise, I'll have him do the prone plank. Again, this incorporates posture and stability, trying to engage both the core and lower back. So for the prone plank, I'll have him start in prone, come up on your elbows, and then come up into a plank. And you'd hold this for about 30 to 45 seconds, and we do it for about 3 sets or so, for about maybe like 5 of them. And then if this was too much, you could do like a modified / floor plank. And then a way that we were going to progress it would be an exercise ball. This might be a little too big, but he can like lay on the exercise ball and do the plank that way. And these are just the pictures. So these are our references. Yes.
For your last one, for the back space, with the, I don't know what the pose was, but would that be more detrimental to the condition? Cobra, yeah. Cobra,
I don't think so, because like when I looked it up, like it said it helped with like engaging the core and the spine, but
I see what you're saying. You're saying
But
don't do it in the
yeah.
max, maybe mod or yeah. That's what I
it
found
might
in
could
research too.
press, it might could compress on the spine a little bit more, so I see what you're coming from there. So yeah, it might be a little bit more compression. So yeah, maybe
Maybe move it to the mod or
Yeah.
phases.
so probably
That's
have
a good
that more moderate feedback.
As far as going over the cones, what can you do as a therapist to make sure that your patient is actually lifting up their leg instead of like going around the cone?
Well, when we first started, she was kind of going around the cones initially, so I had her back up and I had her really like start behind the cone and really like emphasize hip flexion, going up and over this cone and to the second cone.
Okay.
Amazing.
Mm-hmm.